Hey everyone, and welcome to this deep dive.
Yeah, it's going to be a good one.
We know you and your family are looking for reliable information about stress, urinary incontinence, and
Especially for older women, right?
yeah, and so we're bringing you this deep dive to help you feel a little bit more in control and ready to have those tough conversations
Exactly.
with your healthcare provider.
We're going to break down a decision aid developed by the
NSW agency.
NSW Agency for Clinical Innovation.
And it was made specifically for women and their families
Yep.
who are dealing with stress, urinary incontinence, to help make some of those decisions a little bit easier.
That's right.
It's sort of like having a roadmap for this journey, and we're going to be your guides.
Absolutely.
We're going to skip all that confusing medical jargon and just give you the straight talk and helpful insights
Right.
so you can really feel empowered.
Yeah, and it all begins with understanding what stress urinary incontinence is,
SUI.
or SUI for short.
Right.
A lot of women think it's a bladder control problem, but it's actually more about pressure.
Okay, so not about needing to rush to the bathroom all the time.
Not exactly. No SUI is when you leak a little urine involuntarily, when you cough or sneeze, laugh, even during exercise.
Right.
And, it's common,
Yeah.
happens especially as we age, because the pelvic floor muscles that support the bladder, they can weaken over time.
Things like childbirth,
Yep.
menopause, just getting older can all contribute to that.
That's right.
But here's the thing, and this is what I really want to emphasize to our listeners today. You are not alone.
Absolutely not.
This decision aid actually cites studies showing that about 1 in 3 women over the age of 45 experience SUI.
Yeah, it's very common.
And the good news is
There are solutions.
there are solutions.
Absolutely. But before we get into all of that,
Yeah,
we need to make sure we're talking about the right type of incontinence.
because it's not all the same.
Exactly. There's also urgency incontinence, which is that sudden gotta-go feeling.
Yeah.
That sends you running to the bathroom. And then there's mixed incontinence, which is a bit of both.
And this is really where seeing a doctor or a continence health professional is essential.
Absolutely.
They can figure out exactly what type you're dealing with through a few simple tests and recommend the best course of action.
Exactly. And the decision aid mentions that it's not just doctors who can help you.
Yeah.
There's a whole team of specialists,
Oh, that's good.
women's health physiotherapists,
Yeah.
continence advisors, even continence nurses.
Right.
So there's a big team to support you.
That's good to know you've got options. You've got support.
Right.
But now, before we get into the nitty-gritty of managing SUI, I think it's important to think about you, the listener.
Right.
How is this affecting your life?
Yeah.
Your day-to-day activities, work, hobbies, social life.
Exactly.
It's personal, and it's okay to feel however you feel about it.
Yeah, your feelings are valid.
Mhm.
Whether it's a minor inconvenience or something that really impacts your confidence.
Right.
The decision aid actually has this great worksheet.
Called What is Important to Me. And it prompts you to reflect on your priorities and how you want to manage this.
I love that they give you the tools,
Yeah.
to really sort of analyze
Yeah,
what's going on and what you need.
exactly.
Okay, so let's talk about taking action. The decision aid outlines 2 main categories for us.
Yeah. Conservative options, which are non-surgical,
Right.
and then surgical options.
So let's dive into those conservative options first, because those are typically the first line of defense.
Exactly. And they can be very effective.
So let's go through these. The first one we have is kind of the do-nothing approach, or the wait-and-see approach.
Right.
Now, while this is technically an option,
Mm-hmm.
it's important to be aware of the potential downsides.
Yeah. You could have skin irritation from leakage,
Right.
and there is a possibility that it could worsen over time.
Okay, so if you're ready to be proactive about this, there are some lifestyle changes you can make
Yeah.
that are a great starting point. Think of it as taking control with some simple adjustments to your daily routine.
Right.
The decision aid suggests things like weight loss if needed,
Mm.
avoiding heavy lifting, and quitting smoking,
Right.
all of which can help reduce pressure on your bladder.
And there are also some dietary tweaks that can make a difference.
Yes.
Like cutting back on caffeine and alcohol, because those can really irritate the bladder.
Right, they can make you feel like you have to go more.
Exactly.
Yeah.
So it's all about making healthy choices that benefit your overall well-being,
Mm-hmm.
which in turn can impact your SUI.
Exactly.
Now, on to my favorite pelvic floor exercises.
Yes.
So these actually strengthen the muscles that support your bladder,
Mm-hmm.
and the decision aid puts it in such a relatable way.
How do they say it?
Exercising the muscles around your front and back passage.
Oh, yeah.
Very straightforward.
Simple.
And accurate.
Yeah.
But it also stresses the importance of proper technique. So this is something where seeing a women's health physiotherapist can be really helpful.
Yeah, they can help you do the exercises correctly.
Exactly, because you want to make sure you're doing them right to get those results.
Absolutely. And the results can be really significant.
That's awesome.
Studies have shown that 50% of women who do pelvic floor exercises correctly see a cure from their SUI.
Wow.
And a majority experience improvement.
That's amazing.
It's really good.
But let's be real. There are times when you need a little extra help.
Mm-hmm.
And that's where continence aids come in.
Yeah.
So things like pads and specialized underwear that are designed to be discreet and effective.
Right.
So you can go about your day with confidence.
Think of them as like a backup system, especially when you're out and about.
Totally. It's not about being restricted by SUI. It's about finding ways to live your life to the fullest.
Absolutely.
Now, the decision aid does a really great job of breaking down each of these conservative options in a simple table. And they list out the benefits, the risks, and even the costs.
That's a really good resource.
Yeah, so you can really compare.
Yep.
All right, so we've covered a lot of ground with these conservative approaches.
Yeah.
But there's another category we need to talk about, and that is the surgical options.
Right. Now, it's important to remember that surgery for SUI is a big decision.
It is.
It's not something to be taken lightly.
Right. And the decision aid really emphasizes that.
Yeah.
They say you need to have open and honest conversations with a surgeon who specializes in this area, someone with a lot of experience.
Absolutely.
And don't hesitate to ask questions.
Ask all the questions.
You want to make sure you feel comfortable and confident in whatever path you choose.
Definitely.
And of course, as with any surgery, there are some general risks that we should talk about.
Of course, yeah.
Like bleeding, blood clots, potential reactions to anesthesia.
Right. It's good to know those up front.
Yeah. Get those out in the open.
Yeah.
So let's talk about the specific surgical options that are available.
So the decision aid outlines 4 main procedures.
Okay.
There's colposuspension, pubofascial or pubovaginal sling, mid-urethral sling, which is sometimes called a pelvic mesh tape.
Okay.
And then periurethral bulking injections.
Wow. Okay, lots to unpack there.
Yeah.
So let's start with that first one, colposuspension.
Yeah.
It
does sound a bit intense.
Pretty intense. What exactly is it?
So basically, it involves lifting the tissues between the bladder and the urethra and stitching them in place to create better support and prevent leakage.
So kind of reinforcing those natural structures.
Exactly. Yeah, giving them a little bit of a helping hand.
Okay. And those stitches stay in permanently?
Yes, they do. And it can be done in a couple of ways.
Okay.
Open surgery involves a cut in the lower abdomen. And then laparoscopy uses several small incisions.
Gotcha. So different approaches.
Yeah.
But same outcome.
Yeah, basically giving that bladder a little extra help.
Okay. And what about recovery time? I imagine that varies depending on which procedure you have.
It does, yeah. So open colposuspension, you're looking at about 3 to 5 days in the hospital. While laparoscopic procedures are usually shorter, just 1 to 2 days, and then full recovery can take 4 to 6 weeks.
For both?
For either method.
Yeah.
Good to know. Okay, so next on the list we have pubofascial or pubovaginal sling.
Yeah.
What's the deal with this one?
So this one's quite clever. It involves creating a sling using a strip of your own tissue.
Okay.
Often taken from the thigh or tummy. And this sling supports the urethra and the bladder.
Okay.
Providing that extra reinforcement.
So it's like an internal support system made from your own body.
Exactly. And like colposuspension, those stitches are permanent.
Interesting. And what about the hospital stay and recovery for this one?
So hospital stay is similar to open colposuspension, around 3 to 5 days.
Okay.
But full recovery often takes a bit longer, maybe up to 6 weeks or more.
Okay, so both of those options involve stitches and using your own tissue for that support.
Yep.
Now this next one, the mid-urethral sling, also known as the pelvic mesh tape.
Right.
That sounds a little bit different. It does, yeah. It uses a synthetic mesh tape that's placed under the urethra through an incision in the vagina.
Okay.
And then scar tissue forms around the mesh and holds it in place and creates that supportive sling.
So different material, different approach.
Yeah.
But like the other slings, the mesh is meant to stay in permanently.
That's right. And it's generally a quicker procedure with a faster recovery time.
How much faster are we talking?
Usually just 1 day in the hospital, and recovery is typically around a week.
Okay, so that's a big difference.
Yeah.
But I know there have been some concerns about mesh complication in the past. What does the decision aid say about that?
It does mention some potential risks.
Okay.
With any surgery, there's a chance of infection, although it is relatively rare.
Mm-hmm.
And specifically with mesh, there can be issues with erosion or extrusion, meaning the mesh might damage surrounding organs or even become exposed.
Okay, that sounds pretty serious.
It's definitely something to discuss with your surgeon in detail.
Right.
So you can explain, the likelihood of those complications happening.
Based on your situation?
Based on your individual case, yeah, and help you weigh the risks and benefits.
Okay, so it's important to go into that conversation, with your eyes wide open and ask all the questions.
For sure.
Okay, so we've covered 3 sling procedures.
Yeah.
But this last one, periurethral bulking injections,
right,
seems to be in a category all its own.
It is a bit different, yeah. It's less invasive.
Okay.
Instead of a sling, it involves injecting a gel-like substance around the urethra to create a cushion that helps close it off and prevent leakage.
So more like a filler than a sling?
You could say that, yeah, and it's a really quick procedure, usually done as an outpatient.
Okay.
No overnight stay needed.
Wow.
And recovery is very quick, usually just a day.
That sounds appealing from a recovery standpoint.
Definitely.
But I'm guessing there's got to be a trade-off somewhere.
There is, yeah. The effectiveness of bulking injections doesn't tend to last as long as the sling procedures.
Meaning you might need to have it done again?
Yeah. The decision aid mentions that most women need another injection within 2 years.
Okay, so there's that balance to consider.
Yeah.
Less invasive, but potentially less durable.
Right.
It really highlights how important those conversations with your healthcare providers are.
Yeah, for sure.
The decision aid's a great starting point.
It is.
But it can't replace that personalized guidance.
Definitely. It's meant to empower you to ask the right questions.
Right.
And make those informed choices that align with your personal circumstances.
It's about finding the right fit for you.
Exactly.
Whether that's trying those conservative options first or considering surgery.
Yep.
There's no one-size-fits-all approach.
No, not at all. And what's right for you might change over time.
Right.
So it's good to stay in touch with your healthcare team as things evolve.
It's a journey, not a destination.
Exactly.
Going through all these options, it really strikes me how much SUI can impact a person's life beyond just the physical symptoms.
Absolutely. It can affect your emotional well-being, your confidence, your relationships.
Yeah.
And while we've focused a lot on managing the physical side of things, addressing those emotional needs is just as crucial.
Absolutely. And whether that's leaning on your support system, joining a support group, or even talking to a therapist, there are resources out there.
Lots of resources.
To help you really cope and thrive.
You're not alone in this.
Remember that.
Yeah.
And that brings us to a really important question.
Okay.
What could you reclaim in your life with improved SUI management?
That's what it all comes down to.
Right.
Think about the things that you've been putting off or holding back from because of SUI.
Yeah.
The activities, the social gatherings, even the simple joy of laughing freely without worry.
What could you say yes to if those limitations were lifted?
Imagine the freedom and confidence that could bring.
Maybe it's enjoying a spontaneous outing with your grandkids. Or taking that dance class you've always wanted to try.
Exactly.
Or just feeling comfortable and confident in your own skin.
It's about rediscovering joy, reclaiming your life, and living it to the fullest.
Wow. It really is amazing to think about all the things that become possible.
Yeah.
When you take control of your health.
Yeah.
We've learned so much today about SUI.
We have.
From what it is to how to manage it, those conservative options and the surgical option.
And I hope you're feeling more prepared to talk to your healthcare team and make those decisions.
Yeah, this decision aid from the NSW Agency for Clinical Innovation has been a really great resource, I think, breaking things down in a clear, compassionate way.
It is a fantastic tool.
Yeah.
And they even have a whole section on further information and resources and support organizations.
Like a whole toolkit for navigating this journey. But before we wrap up, I want to circle back to something you said earlier.
Okay.
What could you reclaim in your life with improved SUI management?
I think that's a really important question.
Yeah.
Because it's about more than just, treating symptoms.
Yeah.
It's about improving your quality of life and having that confidence and joy.
Maybe it's those little things like going for a walk.
Yeah.
Without worrying about leakage. Or maybe it's something bigger, like taking that trip you've always wanted to take.
Exactly.
Whatever it is.
Yeah.
I think it's so important to keep that vision in mind.
Yeah.
And let it motivate you to take action and to find the right support for you.
Absolutely. You deserve to live your life to the fullest.
You do.
Without limitations.
Well, thank you so much for joining us on this deep dive that was curated just for you and your family.
We hope you found it helpful.
We do hope it was empowering and that you feel a little bit more ready
Yes.
to have those conversations.
And remember, you're not alone on this journey. There's help out there.
So take a deep breath, take that first step, and embrace the possibilities.
Yeah, you got this.